Hello there. The federal government says there's been a breakthrough in its talks with the provinces, signaling a healthcare deal could be coming soon to increase funding for the strained system. This morning, I spoke with Intergovernmental Affairs Minister Dominic LeBlanc about just how close they are to an agreement. Minister LeBlanc, good to see you this morning.
Good morning, Rosemary.
I appreciate you making the time. I'm going to start with some questions about what the Premier of your province, Premier Blaine Higgs, told me on Friday. He said that he's optimistic you and the provinces will be able to strike a deal in February. Is that the timeline that we should expect as well?
I would hope so. Premier Higgs has been a constructive partner in these conversations for many months. I have said publicly our hope is that we can come to the right agreement for Canadians to benefit a healthcare system that all of us are concerned about and be in a position to put whatever financial instruments are necessary in the federal budget this spring. I've said that last fall. So look, if we're lucky, Rosemary, it'll be done in February. If it drags a week into March, whatever. But we want to continue the momentum that I think all of us feel in terms of getting to the right agreement.
Well, a lot of people, I think, are perplexed as to what brought the momentum forward. And when I asked, again, the Premier that question, he says it was public opinion, that there are stories out there, obviously horrifying stories, and people just sort of dismayed at what has become or what seems to be a crisis. Would you agree that it is public opinion that has pushed people to get to the next phase of these talks?
That was probably part of it. I mean, all orders of government share an attachment to an accessible, world-class public healthcare system. Canadians expect us. It's a very highly valued thing for Canadians, and properly so. So all of us, I think, share a view to strengthen and improve it. And you don't have to look in big cities or small towns across the country to find many that are not in a state of crisis. I think the Prime Minister said in some cases the system is sort of cracking at the seams. But I think there was also an understanding from a number of premiers that our desire, for example, for better data is so that the citizens of their provinces can, in a comparable way, look at the outcomes that all of us would be getting as consumers of the healthcare system, people who work in the healthcare system, the family members. We could see that if we increase federal support, as the Prime Minister said he's prepared to do, what better outcomes are we going to be driving together? So I think there was a lot of misunderstanding perhaps 6 months ago around what kind of things the Government of Canada wanted to achieve in terms of better outcomes. Those are largely driven by conversations with the provinces themselves. So it really is very encouraging, Rosemary. And I spoke to a number of premiers this week. Premier Stephenson, who chairs the Council of the Federation, the Premier of Manitoba, and I had a lengthy and good conversation this week. So we'll continue to do that over the coming days and weeks.
From what I understand, you're negotiating an increase to overall healthcare transfers, the CHT, and then separate deals with provinces. Would those separate deals be tailored to the province's needs? Is that the idea, that you get an overall transfer to help you and then you get more targeted money for particular issues?
Yeah, so I think Jean-Yves Duclos, my colleague, has been saying for a long time that when he talks to health ministers across the country, there's a great deal of common ground. Provinces and the Government of Canada want to say, what can we do together to improve access to mental health and addiction services, primary care services, recruiting healthcare professionals, retaining and recruiting them. Huge problem around health human resources. So there are enough common elements that what I think we're saying to the provinces is the particular needs of Newfoundland and Labrador, based on my conversations with Premier Fury, may not be the same as those in Saskatchewan or what Premier Ford would prioritize. So how can there's enough common ground. Let's build agreements as between Canada and the provinces that really focus on the priorities that the provinces identify and drive better outcomes that all of us want for the people who depend on this healthcare system.
I'm glad you brought up Premier Ford. I know you've been asked about it already, but I do want to bring up one of his solutions. All provinces are putting different solutions on the table to try and deal with things. And his, of course, is moving more procedures to privately run clinics, though paid for by public money. The Prime Minister says we're encouraging innovation. That's what we want to see from provinces. I think that's one of your lines as well. How closely, though, will you monitor those kinds of quote-unquote innovations to make sure that they remain viable under the Canada Health Act?
There is a broad level of support for the Canada Health Act in every part of the country, and properly so, because what it says is your access to the healthcare system doesn't depend on some private insurance that you can afford, or you're prepared to pay for procedure X or doctor visit Y. It's because you medically need that particular service. So we're going to ensure the Canada Health Act principles are enforced and preserved. We're encouraged that Premier Ford, in his comments and in conversations we've had, is adamant that whatever innovation within his jurisdiction, within the jurisdiction of the Government of Ontario, will not disrespect the principles of the Canada Health Act. He's not the first province to look at some private delivery of publicly accessible healthcare. I'm talking to this morning, Rosemary, from Moncton, New Brunswick. If I were to call an ambulance here, the ambulance system on contract to the government of New Brunswick is delivered by Medavie Blue Cross and has been for probably more than a decade. So the importance is that people have access to quality health care when they need it medically, and we'll continue, obviously, to work with provinces to ensure that's always the case.
Just two more quick questions. One, what does success look like when this deal is done? What does success look like? A better healthcare system, provinces that are reforming, we won't talk about healthcare again for some time. What in your mind does success look like?
I think certainly in the short term, Rosemary, we're going to talk about the healthcare system a lot because it's under real strain. Canadians have understandable and reasonable concerns around accessibility, around wait lists, around access to healthcare professionals. So even if there's an agreement and federal support for provinces financially increases, to train a radiology technician, a nurse, a family doctor, it's not going to happen overnight. Yeah. So these are medium and long-term challenges that we'll have to work on together. The provinces are committed to fixing these things, and obviously they have the primary responsibility in their jurisdiction. So we'll, if we get the right agreement for Canadians, be in a position to increase federal support. But I think Canadians have to understand that our support is not going to immediately fix some of the challenges that provinces, in our view, are diligently working on and sharing best practices and so on to ensure the system gets through this very difficult period. So the conversation around the importance of healthcare is not going to go away. I think what we hope success looks like is Canadians seeing the federal government and its partners in the Federation working collaboratively on strengthening the healthcare system that's essential to Canadians. And some of these common elements, as I said, mental health, primary care, health human resources, long-term care, all of these things that are so important to Canadian families, we will reassure them that their governments, plural, are working very constructively to ensure that the high-quality, publicly funded, accessible healthcare system that saved my life 3-4 years ago will be around for a long time.
Okay, Minister, we'll leave it there. Thank you so much for making the time this morning.
Have a great Sunday, Rosemary. Thank you for having me on the program.